I'm Dr. Anusheel Munshi, Head Department of Radiation Oncology at Manipal Hospitals Dwarka. Today I'm here to talk about facts and myths related to breast cancer, especially in the context of women in India. So I would be discussing a few issues related to prevention, related to management, related to the common day myths that we often come across, and we have this misconception about what causes and what does not cause, and how to prevent and how not to do this or that. So all these aspects will be taken care of by me in this short talk. You're absolutely right that breast cancer has actually become a very important problem in Indian women. It is the number one cause of cancer now in Indian women. It has overtaken other cancers such as cancer cervix. And because it is becoming such an important problem, I think it is also important for us to understand why is it happening like this. And the reasons for this are manifold. There are various risk factors that are related to breast cancer. These risk factors could be multifactorial. They could be related to our lifestyle. They could be related to our personal habits. They could be related to our genetic or family history. So all these factors and more could play a small role or a big role in causing breast cancer. You're absolutely right that in today's times we are now moving to a more comfortable kind of a lifestyle, and our eating habits have also been kind of westernized in some manner, which means that food such as fatty food, which can cause obesity, sedentary lifestyle, all these can contribute to breast cancer risk. Furthermore, habits such as smoking or excessive drinking can also play their bit of role. You see, you have to realize that breast cancer, one of the factors that can reduce its risk is having childbirth, especially below the age of 30 years. So with more and more urbanization, we are tending to ignore these small things, and that is also precipitating, and that is also leading to factors contributing to breast cancer. So all these things put together, whether it's lifestyle, modernization, westernization, our own habits put together, have led to this increase in breast cancer in the country of India. My message, especially to the younger population of India, the younger ladies of India, would be that it is very, very important to develop awareness and the right habits right from childhood itself. Because once your habits have been set, it's very difficult to change them. So please have the right habits from teenage itself, from your 20s and 30s itself. Try to be not obese, try to be as lean as possible without being underweight. Try to be as lean as possible. Do your bit of exercise every day, a total cumulative of around 150 minutes per week, spread throughout the week, moderate to severe intensity. So all these things can help you maintain a healthy lifestyle, would reduce the risk of not only breast cancer, even other diseases. So that would be the way to go forward. So the question that you have asked is a very important question, and this is the question in almost everyone's mind, that how will screening, or what is the role of screening and how I can do screening. So first of all, coming to the question of breast self-examination. Now, breast self-examination is a technique in which the lady herself would examine her own breasts, and it can be done at the convenience of your own home. The details of the technique are available at authentic sites in the media and in the internet. But briefly, you have to do an inspection, which means in standing in front of the mirror and looking at both breasts and looking at their overall shape, whether there is any change in shape or size of the breast. Then the same technique could be done with arms by the side and then arms above your head, so that again you notice if there is any change. And then finally you can have a feel, because one always has a feel of one's own body. Since our birth, we know how our bodies are. So you can have a feel by your hands, both the breasts sequentially, to see if there's any change or alteration that you didn't feel before. That essentially is what is the meaning of breast self-examination, and you can do it say once a month or once in 2 months at home. Coming to the bigger issue of breast cancer screening. Now, breast cancer screening is a very important thing, but you have to realize that what the guidelines are telling you. So from 40 to 50 years, there could be, but there is no certain role of techniques such as mammography. But in selected cases, and the doctor would tell you, in selected cases, it could be done and it should be done. 50 to 70 years, there is a big role, there is evidence supporting use of mammography every 1 to 2 years, between 50 to 70 years or so. Beyond 70 to 75, once you cross 70 to 75 years, again the role of screening comes down a bit. So all these things are a bit technical. I have tried to simplify them before you, but you certainly, the best way would be to consult your doctor, and he will be in the best position to guide you if screening would help you in early detection of breast cancer. See, when we treat patients of breast cancer, one of the things that comes up often is ignorance and myths and misconceptions in patients, their families. Sometimes it's so sad that patients have been carrying their lumps for months without disclosing it to their family members. Either this is because of the social stigma, or this is because of general fear of detection of cancer, or this is because of the financial implications that could be caused to the patient or the family because of this. And it's really very sad when we see situations like these, because so many of these cases, if they were detected early, would have been treated with a very curative intent. And because of these delays, sometimes you cannot do as much as you would have liked to do for that patient. That's a very important question, and breast cancer in men is something which actually no one talks about. And men have breasts too. So breast cancer can happen in men as well. Although if you see the overall breast cancer picture, men would account only for around 2 or 3% cases of all breast cancers. Having said that, we do see patients, men, who have breast cancer and the risk factors that could contribute in men could again be multifactorial. One, it could be related to age, it could be related to, again, lifestyle, it could be related to factors, some genetic factors such as Klinefelter syndrome, undescended testes or testicular problems, which can again cause a high kind of a estrogenic environment and lead to increased risk of breast cancer in men. So this is again an important issue. It is not talked about as much, but nevertheless it remains a problem and should be discussed. At Manipal Hospital Dwarka, we have a very unique and a very robust mechanism for treatment of breast cancer. New patients of breast cancer, or whether they are seen in the OPD by any specialty, be it surgical oncology, medical oncology, radiation oncology, or any other specialty, all the new patients who have been detected with breast cancer, they are brought to a multidisciplinary tumor board. What essentially is meant by a multidisciplinary tumor board is that you have a board, you have a meeting where you have all the specialists. You have to remember that breast cancer cannot be managed by a single specialty or a single doctor. It has to be managed by 2 or 3 different, or maybe sometimes more, different specialties and different doctors. And it's always advisable for these multidisciplinary tumor boards to discuss each and every new patient, so that at the beginning itself we can chalk out a plan, we can devise a methodology, a flow chart as to how we would be managing this particular patient with all the problems or the performance status issues or other problems or the comorbidities of that particular patient. What is the best way to manage that particular patient? This is what is discussed in multidisciplinary tumor board. What sequence would be followed? Would it be chemo first? Would it be surgery first? What would we do? What will we do subsequently? So this is the approach, which is very evidence-based approach, that is followed at Manipal Hospital. So once it's very important for all of us to be aware, to be cognizant of the risk. But that doesn't mean that we should get frightened, we should hide ourselves somewhere. See, this is a thing that should be discussed. We should try to get as much information as possible from the right sources. What we see commonly is that patients and lay people, they often the first thing that they go to the Google. And Googling, you get n number of responses, you get confused, sometimes you get frightened, and then there's a big problem. So it's very important to get information, get awareness, but from the right sources. And your best friend is your doctor, because they are the people who have seen these cases, who have managed these cases for n number of years. So go to an experienced oncologist, get the information from him, and then take the decision, then take it forward. That is the way I would say.